My name is Richard Breen, I'm 65 years old and I've just had a quadruple heart bypass. After a routine checkup, I was diagnosed with all four main arteries as seriously calcified. I underwent angioplasty for the insertion of stents, but halfway through the operation, the surgeon decided my arteries were too bad. I was in for a bypass. The three professionals treating me at the time were adamant that I needed open heart surgery, osteotomy for a quadruple bypass. This involves cutting the breastbone vertically, which is quite invasive. I was also told that keyhole surgery was not suitable for me. But I'm a property developer, and we never take the advice of just one estate agent. So I carried out my own research and came across a Keyhole Heart Clinic's website, where I was impressed by Mr. Birdi's simple, clear and convincing support of keyhole surgery as an alternative to spatchcocking the patient, as I call it, through open heart surgery. I needed to see whether it could work for me, so I arranged a meeting with Mr. Birdi after sending him a full package on me: angiogram, scans, ultrasound and stress test results. He was punctual, completely up to date on my file, and able to confirm in his calm, reassuring and confident manner that he could bypass the two main arteries through keyhole surgery with stents put in to the remaining two. Mr. Birdi then sent me off to a stents doctor and for an aorta scan, both confirming that I was suitable for his diagnosis. I talked to Bupa and took two other references from friends' doctors who all confirmed that Mr. Birdi was professional and reliable. On the morning of the operation, Mr. Birdi asked for permission to bypass more arteries if he could, which I duly gave, and I woke up having had all four arteries bypassed with no stents needed.